to begin with, what kind of symptoms were you having prior to that treatment?
For several years, my back has hurt off and on, but
Okay.
this past February, it started getting more intense, and then I had the pain shooting down my legs and everything.
Okay.
So, I initially went to a chiropractor who referred me over to here.
Okay, to Precision Cane Care. And then,
Yes.
Dr. Battista, you had several types of treatments for the pain before you ended up going on to the mild procedure, correct?
He had injected steroids several different times.
Okay.
The first time, the pain was relieved for about 48 hours, and it decreased the next couple times.
Okay, so you had a good response, but it was very temporary.
Correct.
With the more conservative injection type of
Right.
treatment. You've done the physical therapy as well, or chiropractic care?
I did the chiropractic care, and it would help for a little bit, but then it always came back, and the pain just got more and more intense, and I had to give up my golf game too.
Okay, was that one of the big things that you noticed had changed as far
Right.
as your activities?
I was popping Tylenol quite a bit, during the course of playing, just to keep the pain down.
Okay. And had you tried other medicines as well, like ibuprofen or
Yes.
muscle relaxants, things like that?
Yes, I did.
None of them had a whole lot of effect.
Including the CBD oil under the tongue and everything.
Okay. So you tried all kinds of things
Yes.
prior to coming here in the first place, had some conservative treatment with injections, and then looking at your MRI, I guess it was determined that the ligament that lines the spine had become inflamed or what they call hypertrophy.
Yeah.
And Dr. Battista then talked to you about the mild procedure, correct?
Correct. Well, he had gone over several different procedures that I could choose from, and I settled in on the mild because I thought that was going to be the easiest and quickest to recover from.
Okay. And in your terms, how do you understand the mild procedure? What is it that was being done for that treatment?
Between the joints and the vertebrae.
Okay. Kind of in this area?
Correct. My understanding was that they would go in and nick away at the ligaments there, so there was less there to be compressed and put pressure on the nerve.
Okay, so you have a pretty clear understanding.
Yes.
Essentially, there's a ligament that runs along the inside of the spine that contributes to narrowing of the spinal canal, termed spinal stenosis. And one way to reduce the inflammation or the narrowing of the spine is to reduce the size of that ligament by going in with the mild procedure, which that stands for minimally invasive lumbar decompression. Okay,
Right.
it's an acronym for that. But through a very small instrument, you can go in and remove some of that ligament to give extra space. So how long ago did you have that treatment?
12 days ago.
And have you seen much improvement?
A lot of improvement. I'd say before the procedure, my pain on a scale of 1 to 10 was around a 7 or 8. It's down around 3 or 4 today. In fact, I just played my first 9 holes of golf this morning. And well, the golf isn't very good right now.
And then for your golf game.
Yeah.
Okay.
But I was out there swinging, and I noticed that I have to work on my short game again.
Okay. So how long after you had the procedure did you start to notice any change in your symptoms?
Probably the very next day or 2 days at the most. In fact, I made a comment to my wife that I think I'm going to go back out on the Appalachian Trail and do some hiking again too.
So was standing and walking one of the things that you noticed that you were limited in your ability because of the pain?
Correct.
Have you seen an improvement in those things?
Yes.
Okay.
I do. I want to say I'm sore, but it doesn't hurt.
Okay.
And once in a while it is a little more sore than at other times, but it comes and goes, but it's not as intense, and it's a duller pain.
Okay. So overall, at this point, I mean, it's only 12 days out, and hopefully there'll be some continued improvement. But how much better would you say you are now compared to what you were before you came here in the first place?
Oh, a lot better. A scale of 1 to 10, probably 3 right now. Like I said, I was out swinging the golf club today, which was an enjoyment.
Good. So, well, it's always gratifying to see a significant response, and this tends to be a fairly long-term type of approach to treating some of the symptoms due to spinal stenosis that is caused by the inflamed ligament. There are multiple causes of spinal stenosis, this is certainly one that lends itself to a fairly minimal type of treatment. Now, when you had this done, was it done here in the office or at the surgery center? Or?
I went to the surgery center early in the morning. You know, they got me right in. The nurses and all the technicians were very attentive. And as I was done, they wheeled me out to the car. You know, I got out of the car and walked in the house.
Okay. And were you put to sleep or given sedation?
Yes.
Or?
Yeah, I was put in or sedation.
Sedation.
Yeah.
Okay. So you don't have to have general anesthesia to have this type of treatment then. Where you're put completely out?
I was put completely out. Is that?
Okay. Was it just sedation or was it general anesthesia? Do you recall? Did they
I
have to
was-
place a tube into your windpipe?
If they did, I wasn't aware of it.
Okay. So you were
Yeah.
heavily sedated.
Yes.
So I don't think you were under general anesthesia
Okay.
for this type of procedure, but you went home within an hour or so after
Right.
finishing that.
Right.
Okay. And how big was the incision that was used?
Well, I can't see it myself, but from what I understand, it's pretty small.
Okay. Yeah. And generally, it's really a needle stick is all it is.
Yeah.
So it should be a short recovery and very minimal risks associated with these more advanced treatment options that are available now.
I'm pleased with the way everything went, and I would recommend it as an attempt for someone to ease their pain and suffering there.
Yeah. Yeah. Certainly beat some of the more aggressive things like
Right.
surgery, infusion, and things like that. Okay. Well, do you have any other thoughts or comments on your experience with this?
The entire staff was very attentive and helpful, and I'm just glad that we've gotten to this point right now, and I hope to continue to get better, and at my golf game too. So.
There you go. Okay. Well, thank you very much. I appreciate you coming in to talk with us. It's
Thank
nice
you.
to meet you.
And good luck to you.